Dr. Brooks?
Good morning.
Hey, how are you?
I'm doing well.
And we're sitting in your office here at our Pensacola office, where you are the medical director and our staff physician. You've been in that position for how many years now?
About 6 years now.
Okay. And we're going to talk today about the meningitis outbreak, and I think it'd be helpful if you were to maybe explain to everyone where we're at now that it's been developed, and what we know and what we can tell people about the signs, symptoms, and how to get treatment.
I think most people realize now that a tainted batch of steroid was released from a New England company, the New England Compounding Center, and that's been used on patients in several states, including the Pensacola area. I believe most of the initial exposures have been identified, but there still is a chance that people out there who receive the drug have not realized yet that they've been potentially infected. Patients are being treated, and the reason for what happened is trying to be understood at this point.
Dr. Brooks, as a board-certified medical doctor, you're pretty familiar with the procedures that we're discussing with respect to the steroids and the injections, correct?
I am. My practice was in the field of anesthesiology. I also did pain management, so I'm very familiar. And probably one of the most common nerve blocks we did was an epidural steroid injection. So I'm very familiar with the technique, the process, and what's done to treat patients with epidural steroids.
And Dr. Brooks, the community now is pretty aware of what happened with these steroids and these injections, but can you explain the difference between fungal meningitis and the other types of meningitis?
There are three types of meningitis, viral, bacterial, and the third, and fortunately the least frequent, is fungal. Viral and bacterial meningitis have different courses and different treatments, but fungal meningitis is actually extremely rare, but for situations like this. The symptoms can develop very slowly in weeks or even months after exposure. So that's why knowing if you were exposed is very important, because you have to be very vigilant and watch for the signs and symptoms of meningitis that can occur even weeks or months after the exposure.
Describe or tell the listener, or those that might be watching, what those signs and symptoms are.
Okay, and it's a good point. And they're really very similar to the other signs and symptoms that people would have if they had viral or bacterial meningitis. But they should look for a new or worsening headache, any sensitivity to light. We call that photophobia. So if a bright room or being outside becomes uncomfortable, you should consider that a positive symptom. Pain of the neck, meningeal pain, where your neck is not maybe the normal stiff that you might have during the day, but actually a true pain where you raise and lower your head, and there's actually pain in the back of your neck and going down your back. Any changes in mental status, any slurred speech, anything else that would be indicative of a change in the central nervous system should be considered. Any weakness or numbness that's new could be a possible sign. The other thing is any pain or drainage or any inflammation at the injection site. Of course, the infected steroid is being injected through the skin, and that can become a potential infection there also.
And Dr. Brooks, as always, there's some bad information out there as well as good information, but tell our viewers, if you would, what the likely scenario is, and whether people are going to get spinal taps in every circumstance, or what's the likely course of treatment to work up a patient that might have this fungal meningitis.
The first step, if you don't have symptoms, is to contact the doctor who did the nerve block on you. He'll check the lot and check and make sure that you were or were not given a tainted batch. And at that point, if you're without symptoms, and for example you did obtain a dose of steroid from a tainted batch, I believe observation is the key at that point, very close observation. If any symptoms develop, then you should contact the doctor, and he will direct where you to go for your workup. A spinal tap may be necessary. It's probably not any more invasive than the actual nerve block that you had. So it's done frequently and is necessary to get spinal fluid. They'll also take blood samples to look for the fungus. But at that point, you're probably committed to be given therapy. They will probably start you on antifungal medication then, because those cultures take weeks or longer to come back. So once you have symptoms, the best way to approach is to culture and then treat right away.
So in summary, Dr. Brooks, would you agree that it starts with communicating to the facility to determine whether or not you got a contaminated batch, and then determining whether or not perhaps you have some of the signs and symptoms of meningitis, and then progressing to seeking treatment to deal with those symptoms?
That's exactly right. I would stress the vigilance, because fungi grow very slowly, and it could be weeks or months before clinical symptoms occur after exposure to a tainted epidural steroid. So that should be kept in mind. Any unusual symptoms that fits the list that we've gone over should be called into the doctor, and appropriate action will be taken by him or her.
And I know you're watching this real closely, Tim. You've been updating our blog. If anybody has any questions, obviously they can call the firm, or they can go and check your, not quite daily, but pretty frequently updated blog entries, right?
I try to update the blog when there's new information, but of course an email or a call, and the CDC and the FDA websites are listed on the blog, and they're also excellent sources for new and current information.
Thanks, Tim.
Thank you.